Hi, I'm Jasper Peach, and along with Women's Health, Lod and Melly, I'm gathering stories from people like me who have compromised immune systems. Here on Dja Dja Wurrung Country in Castlemaine, I'm speaking over Zoom with people across the Lod and Melly region.
My name's Christine. I live in Bendigo. I've been living here for just over 3 years. Moved here from Melbourne, where I'd lived for a long time. I'm in my early 60s. I have kind of some complex health issues. I'm immunosuppressed following a transplant that I had 6 years ago, following a couple of years of cancer treatment and various other treatments. Prior to the transplant, and I worked in community and public health. I was in senior management role, and I was sole parented a son who at the time I was really sick was a teenager. So post-transplant, because of the complications, I never got back to work. So I moved up here because I'd lost my income basically, and I'd had to sell my house in Melbourne because I couldn't afford the mortgage and blah, blah, blah. So I came up here for affordable housing basically. I didn't have networks or anything in this area, so I was a bit naive and thinking, oh, well, you can just sort of uproot and go up there and everything will be good. But I guess I was also assuming I still could muster some capacity to reestablish. I really didn't. So I'd been here a year, and then COVID came along, and I'd started to make some kind of inroads into the community. I'm also a writer, a poet, and I was very involved in the spoken word community in Melbourne. And I'd had ideas about kind of being part of something here as well, but that didn't really occur. So then COVID came along, and once I sort of wrapped my head around what it kind of meant and what it was, and I guess having lived with immunosuppression already and having what precautions were required for my own protection and safety. I was quite used to those. I practiced those, not to the degree that I guess I did then with COVID, but really what happened was I just became completely isolated. And for the first year, I was still needing to have procedures in Melbourne every 3 months in the specialist in the Austin Hospital. So I was having a lot of medical toing and froing, and then the requirement for that stopped. So day to day for me, particularly in the times of COVID, means that I have developed social phobia. that includes some friends who know me and who've known my situation, and I'm very mindful and respectful of that. However, unless you have that yourself, you don't think through all the detail of it. What's their social network and their social network's social network and all the rest of it. And so the day-to-day experience of being immunosuppressed, maintain a fairly isolated, socially isolated existence. I have a handful of medication for breakfast, and that affects me in all sorts of ways. So the side effects from that. It also complicates my health, my other health. So I've just been diagnosed with breast cancer, for example, and that's probably because of immunosuppression. I struggle to find sort of meaning often now that I'm in this situation, and a day-to-day level, what that is I guess the places that I will go. So I will go to the supermarket, and I'll be one of 3 or 4 people with masks on in a supermarket still. As the restrictions have relaxed, it makes us more vulnerable, and so that's disappointing because there's a fatigue that comes with that on top of a fatigue that I live with anyway because of my medical conditions. Certainly does impact mental health. So within that, there's been a real loss. If I'm around other people at all, I'm wearing a mask. I'm still the one that sanitizes and wipes down my shopping trolley and all the rest of it. Goes to places when it's not busy. It's less likely to be busy. I do walk my dog, and I don't wear a mask for that, but I go to places like I go in the bush. Fortunately, I'm located bush at one end of the street and at the other end of the street. So I just steer clear of people. The physicality of it all is that the immunosuppression that I'm on, it gives me brain fog. So it gives me brain fog, it gives me fatigue. I don't sleep. I have terrible insomnia. I have restless leg syndrome through the night, which is just horrendous. I mentioned cancer, but I've also developed osteoarthritis and tendinitis. So it feels like accelerated aging is what it feels like. I feel like I'm about 30 years older than I kind of am.
Is there anything that would help you feel safer in the world around coronavirus?
I guess there's a couple of things. One would be if it just disappeared, that would be great. I'd feel safe then. And I think if there was a greater sense of social responsibility, that would help too. But the dismissiveness of underlying health conditions as a term, as this sort of blanket term, and people who died, or they had underlying health conditions, and it is so dismissive. What brings me the most joy is joys can be a bit hard to find sometimes, so I do seek it in the bush and birds and bees and plants and my dog and my son. If I guess he's probably, that's a real strong protective factor. Kids are, because you've got, and just stick around for your kids. So they give me joy, although my son now lives in Sydney. I don't know, joy, it's just in the small things. Just try and find something small here, but it could just be the lorikeet out the window there. That's, those sorts of things are what sort of bring me joy. As a transplant recipient, and with that comes immunosuppression, so the two go hand in hand. It's fraught territory, it really is, because on the one hand, you're very lucky. We're very lucky to have had a donated organ, to be, got on the waiting list in the first place, and then to have been successful in getting a transplanted organ. So very mindful of that, very mindful that with that comes, in my case, in most cases, for the type of transplant I have and for heart transplants and all the rest of it, it means someone's died. It means there's a grieving family. It means there's great, huge loss that's kind of happened somewhere, and that in the midst of that loss, a family has made a really difficult decision so that other people who are dying, as I was, can, not die.
You can play your part in protecting people in our community who have compromised immune systems. Vaccinate, boost, wash your hands, mask up and stay safe. Women's Health, Lodd and Malley, centering the voices of people with compromised immune systems.